We are engaged in production of veterinary pharmaceuticals from herbal extracts. The herbal extracts are safe in terms of public health. They have less withdrawal effects. They are affordable, they are locally available, and they are effective. We have been made to, our main agenda is to introduce and champion the organic herbal extracts, which are more safer, which are biodegradable, in that when you use it, it breaks down and forms manure. The conventional medicine is not easily biodegradable. It stays and contaminates the soil, contaminates the water, kills aquatic animals, and we also consume it because its withdrawal period is long. We consume it in animal products, in milk, in meat, in eggs, and everything, and puts our health at risk. So and other microorganisms that are resistant to the current antibiotics and acaricides. The answer is the alternative medicine, which can be obtained from herbal medicine. Now, herbal medicine, some people go wrong because they think it's about they want to take it as much local and cheap as they would assume. But herbal medicine makes a lot of sense if you test the plants you want to extract raw materials from, in terms of their phytochemistry, the components that are contained in them. Then their safety, the microbiology, the molds, the yeasts, and all that, how safe they are to the consumers. Now that comes to the only alternative being herbal medicine. So if you go through that, you test the microbiology, you test the phytochemistry, you understand the type of phytochemicals you need, then you ascertain that they are safe for human consumption. And then you go ahead with registration. You go to National Drug Authority, register them. You have National Drug Authority have them verified, and they are put on the register of National Drug Authority. Having done that, you can sell it anywhere you wish, and it will be authentic. Our community and some institutions do not consider Ugandans, do not expect Ugandans to hatch out something that is really that can solve a problem. This initiative takes a lot of expense in terms of machinery. The machines are expensive. In terms of maintaining the working capital, because you manufacture drugs of maybe 50 million, take them in the field, you not come back with the money that very day. They will take them on credit, then you come back and you will have to manufacture more. If you don't have enough equity, you can fail out. Then the issue of testing them is also rigorous, like I told you. It involves lab work, it involves a lot of work that you can do. One product can take you over 1 or 2 years to obtain all the necessary documentation to have it certified. The drug remedies, we have a vitamin supplement, so that is a substitute to people who are using ARVs in poultry. We have milking salve. We are the only people who do that. All our formulas are generic. Generic, I mean that they are not anywhere else. They are with us alone. Now, some people buy generic formulas, and then you make a brand name out of that formula. Ours are not anywhere else. So we have a vitamin, we have a milking salve, we have a wound spray, we have a disinfectant. And we are developing an eye drop, which National Drug Authority requires us to have a sterile facility, because it is categorized in sterile injectables, the one that is used to inject it. So National Drug Authority requires us to have a sterile facility, which requires a very expensive, which is very costly to construct. It could go for around maybe $1.5 million to construct one. So we are developing an eye drop, developing mineral blocks, we are developing others. So for now we have a vitamin, we have a milking salve, we have a disinfectant, and a wound spray. Actually what we look up to is training the farmers, because some of them are actually crops like moringa, like tobacco, like they're not very confidential extracts. So we want to build the capacity of farmers to be able to supply us, but we also want to acquire some land. We have not yet gained the capacity to acquire that land. We would want to acquire some land, establish the gardens for those raw materials. In the meantime, we would be supporting farmers in terms of quality assurance, in terms of agronomic practices, in terms of to supply us quality herbal extracts, which are raw materials. And at the same time, we would want to involve farmers and other, ordinary Ugandans, like we called it, to give us as much information as they know about this, because we want to engage them, want to engage the farmers who are developing this for. You develop a product, go back to them, ask them how it works. They give you feedback. It helps you to improve it, to bring a better solution for them.